But there are all areas that impact every single one of us. I can't imagine there isn't one of those groups that I've listed that you can't sit back as any Iowan and think either that is me, that is impactful in my life directly because of my family or my community or where I work. Everyone's going to have some sort of impact. And when we start from that level set, and this is not them, this is us, this is everyone, and we start from that place of let's level set with the fact that we're going to come at this with an understanding that everyone, and I can truly say that for EveryStep, everyone is doing the best that they can with what they know right now. And no question is we're going to go in with the most gracious of intent. And once you have that level set, then the real learning can begin.
Welcome to the With You at Every Step podcast. We address your healthcare questions and help you navigate life's challenges. Our guests share their expertise and real-world advice related to care for older adults, grief and healing, and pregnancy and parenting. EveryStep is a nonprofit healthcare and human services organization offering dozens of programs that are there when people need us most. Learn more about our free and low-cost services at everystep.org. Thank you for listening. And here is our host, Polly Carver-Kimm.
Thank you for joining us for With You at Every Step, talking about a really fascinating topic, I think, today, and that's health equity. First of all, you may hear that term, health equity. What does it mean? How do you achieve it? What are some of the ways to get there? That's what we hopefully will talk about today. And our guest is Jen Groves, Vice President of Community Health Services at EveryStep. And Jen, we want to welcome you back to the program.
Thanks for having me, Polly.
Well, this is a topic that EveryStep in particular is so deeply involved in. And I guess probably the way to start off, maybe for folks who aren't in that arena where it's something that you can encounter every day or think about every day, what does health equity mean?
Pretty simply, health equity just means that every person has the opportunity to achieve optimal health, regardless of all of the other things, regardless of the color of their skin, their level of education, gender identity, sexual orientation, the job that they have, the neighborhood that they live in, or whether or not they have a disability.
And you have to correct me if I'm incorrect here, but equity is not the same as equal. It can be equitable and equal at the same time, but it doesn't necessarily mean if person A has, health insurance with a deductible of $100. Yeah, I've never heard of a plan but like that. But that everybody needs a plan like that. That's not necessarily equity. It's having the access to those kinds of services. Is that correct?
That's exactly correct. Equality and equity are separate, two different things. And so when we're talking about equity, we're talking about opportunity, that there would be opportunities for folks to get to the same health outcomes, regardless of those other things. So the way I think about it, and I know you've seen, you can YouTube or TikTok these all day long, but you've seen the visual representations of equity versus equality. A group of folks of all sorts of different varied intersections of their personalities will all be lined up, and they'll say something around privilege, right? You grew up with two parents in your household, and that person takes a step forward, and those who didn't stay on that baseline. You had access to 4-year degree, which was paid for. You take another step forward. So what we're talking about there is not equality. Everybody started on at the same point, but through different privileges, some folks got a couple steps ahead, and they got a head start in some ways. And so what we're talking about with health equity is no matter where you are in that lineup, when those questions end, everyone, whether you're still at the baseline or whether you're almost to that finish line, everybody has the same access to whatever it takes to get them to have optimal health outcomes.
How do we work towards that? There's so many, like you say, there's so many different intersections of our lives and how we access things. Do you, as a vice president of EveryStep, do you take into consideration different populations and how they have been affected by inequities? Or do you look at the big picture and say, here's what most people who who have had inequitable situations. This is what we see the most. And so let's address that.
Both,
Okay.
honestly. There is a basis in every step in especially the community health services. Our care and support programs have really made a commitment to health equity. So everything that we do within our scope of services have a health equity lens, and I'll talk about what that means from a big EveryStep perspective all the way down to a program level. But we also take a look at statistics, and we know that there are some startling statistics around health disparities, especially around race, and that is a direct tie back to health inequity. And so when things are on fire, we want to make sure that we're trying our best to put those out. And so we may have a specific focus around an issue like maternal mortality with folks who are Black or brown. That's going to be something that we're going to be very targeted on and look at some specific interventions for that health inequity, where we're putting other more global policies and procedures in place for the rest of the organization. So, to answer your question, we do both. It's both at a macro and a micro level that we're trying to combat some of these inequities.
So why don't you go ahead and tell us some of the things that EveryStep is doing on the big scale and then individual levels too?
Yeah, absolutely. So we really are looking at organizational capacity for health equity. And one of the ways that we do that is we have a really impassioned and vibrant diversity, equity, and inclusion committee. And that group of folks, it's open to anyone on our staff to join. And we do have a really good cross-section of folks around all areas of EveryStep. And as folks, I'm sure listeners know, EveryStep is very big and very broad. And so to be able to have representation across all of those areas has been great. One of the things that the diversity, equity, and inclusion team has done in the last few years is looked to outside content experts and asked them to come in and take a look at things like our human resource policies and procedures. Can you audit these and make sure that they are the best and most inclusive? If we've got things we need to change, then we're committed to making those changes. If there are things we need to add, then we're going to look at that. And so we've had 2 external groups come in, look at policies and procedures, and give us feedback. So as an organization, our commitment to that organizational capacity change is there from our president and CEO to everyone who works for the organization. There's a commitment also to ongoing learning. And so with our education and professional development, we have opportunities pretty much for everyone in the organization to be able to have some sort of ongoing professional development in diversity, equity, and inclusion, or health equity, really spanning all of the services that we provide. And so that's a commitment that the organization makes, not only to the folks that work for us and work with us, but also to our community. We're going to provide our community with experts in these areas, not only to help lead the way, but also to care for folks in the most and best way.
I think that's a very brave thing to do, to have outside advocates or outside entities come in and take a look at what you think. Nobody puts together policy that they think is inequitable, but to be brave enough to say, come in here and take a look at this. Are we really doing what we say we're doing? That takes a level of courage for any organization to be willing to open themselves up and say, we want to do the best we can. Maybe we're not. Do you see what's happening here? And I'm assuming that, how do I want to put this, is that when you put together policies, you don't, intentionally go about saying, well, we want to make sure we discriminate against this group of people. Okay. You're doing the best you can. We're all doing the best we can. Okay. And when you have another viewpoint come in, they can see it through another lens and say, well, but did you think about this? That's kind of the whole point of that, isn't it?
Exactly. And we reached out to community experts. And so we knew that the folks that we were having come in would be those content experts in those specific areas. But that bravery, Polly, I tell you, that bravery is something that I admire in our leadership. And it's one of the reasons that that EveryStep feels like home to me, because we are able to look around and say, are we doing the best? We don't know. And why don't we know? Because everyone has some unconscious bias. And so when we look around the leadership team, when we look around our caregiving teams and we say, okay, are there gaps in areas that for all of our big hearts and all of our excellent understanding and education, there will be implicit bias and unconscious bias that we literally don't know about. And so we need folks to come in and kind of shine a light in some of those areas. And then we are humble enough and understanding enough to know when you know better, you do better. And thank you for telling us, and thank you for helping us learn. And now we'll do better.
I think that's another good point just to talk a little bit more about is, sometimes diversity, equity, and inclusion can almost be polarizing in some ways. You get these two camps that think they think it's one thing or they think it's the other. But it's really just about being good human beings, right? and being able to see, it doesn't make you a bad person, in my opinion, to realize, oh my goodness, I didn't even know that. I didn't know that about that group of people, or I didn't know that about that population. That doesn't mean you were a bad person all your life. It just means that you open your eyes a little and try to understand other people better, which is just kind of like being a good human, right?
When I read that first list at the very beginning of our conversation about the things and the parts of people that may mean that they would have some inequitable outcomes, right? So yeah, I talked about color of skin. I talked about sexual orientation and gender identity. I talked about level of education, but I also talked about neighborhoods. I talked about abilities and disabilities. I talked about jobs that folks have. Age is also relative and very important. And so when we start to look at all of the different areas, not just some of those areas that may be most, that come right to the top of your heads, but there are all areas that impact every single one of us. I can't imagine there isn't one of those groups that I've listed that you can't sit back as any Iowan and think either that is me, that is impactful in my life directly because of my family or my community or where I work. Everyone's going to have some sort of impact. And when we start from that level set, and this is not them, this is us, this is everyone, and we start from that place of, well, let's level set with the fact that we're going to come at this with an understanding that everyone, and I can truly say that for EveryStep, everyone is doing the best that they can with what they know right now. And no question is, we're going to go in with just the most gracious of intent. And once you have that level set, then the real learning can begin.
Yeah, it is true. EveryStep is unique in that in my experience, where you can get a hold of the Diversity, Equity, and Inclusion Committee and say, we're trying to we're writing something for the website for this population. Is this the right word to use? Is that going to be offensive, or is that not clear? And there's never any, well, why didn't you know that? Who are you? It's just everybody wants to help each other and do the best that we can and grow in knowledge. So,
and that's a great point, Polly. One of the other strategies that we're using at EveryStep around, becoming, going closer and closer to having it health equity within our organization and community is that engaging of community members and partnerships. And so that was one of the things that I talked about with the policies and procedures. We often look outside of EveryStep to look at those experts in the community, not only for things like a global policy and procedure, but can you help us with, this curriculum? Would you be willing to come on board as a subcontractor, because we want to make sure we're paying folks for their work and for their education? Can you come on and help facilitate this group if we don't have someone on staff? And so we really do rely on our community partners and engaging in things like our Healthy Start Community Action Network. Last year's focus, or the last focus, was around safe sleep. And this year, in this kind of segment of times, focuses on that Black maternal health. So we do that panel is made up of internal EveryStep folks, but that Community Action Network is content experts throughout the healthcare system in the community come together and make those decisions and create that strategic plan for that group. And we couldn't do it without our community partners.
Absolutely. Let's delve down a little bit to the individual level. How does health equity work for individuals or small groups? How do we address that?
We have some very specific strategies and educational opportunities for folks that are racially, ethnically, linguistically driven. And so we have a prenatal class called Black and Birthy. Curriculum was written and the program is facilitated by Black healthcare folks and experts, specifically making sure that folks have not only the childbirth education and the prenatal education that they need, but the specific content around why there are health disparities with that population and what we need to do to combat them. And one of the perks and one of the benefits of being enrolled in one of our services is we also have a Black doula program. And so that Black doula will partner with a family, that birthing partner that is Black identified African, of African descent, pairs with them and talks to them about not only, again, all of the education, all of the things they need to know, but then really talking about what it means to be Black, what it means to be pregnant and birthing in a Black community, and what it means to advocate not only for yourself, and in some spaces it's not safe. There are lots of times when it takes maybe an external person to have that voice, and that's safer than the person themselves having that voice. And we want to be able to go into potentially a scary healthcare situation and have folks know that they've got advocates and people right there with them, walking beside them.
And there's other ways too. I just some experience I've had with the Afghani community. There's a lot of effort going into that, learning customs, learning, how to best operate in that community to help the mothers and the dads and the children. And there's been a real effort in that area too.
Absolutely. Some of our kind of our mitigation strategies around, barriers to health access include linguistic capacity for all of our services. And so that means we have internal folks that come from the communities that we're serving and also speak a variety of different languages. But we also have a commitment of resources outside of that. So if we do have either we're at capacity with our human power, or we have maybe not capacity for a certain language or dialect, we utilize telehealth in our phone interpretation. So language acquisition should never be a barrier to EveryStep services. We will figure out a way to communicate in the language and in the style that fits folks the best. We also know that health access looks differently now, especially, I think one of the unintentional, consequences of COVID was that we started to unbox the way that we provide services. And so some of those now it's virtual care. So where we may have just offered a home visit before, home may not be safe for everyone. And we don't necessarily say come to our office because transportation can be a barrier. So we also look at group settings where we could provide transportation and that gives a peer support and that camaraderie of other folks, because isolation is true too because of COVID. And so pregnant folks couldn't get together with anybody and make sure it was safe a few years ago. So we want to make sure folks have community. So we offer group sessions. We also do virtual sessions if that's the way folks feel most comfortable. So another part of that health equity lens, again, is no matter where you live, no matter where your job is, we're going to figure out a way to come to you.
Yeah. And, I went back again in my mind to the fact that we offer, or anybody who's focusing on health equity says, we're going to get you to the birthing class. We're going to provide an interpreter for you. We're going to get you to that same level that everyone has with the access to these services. But just like a woman or a man or anybody who doesn't have the challenges that some of the populations do, may have easy access to healthcare, but they choose not to go. Okay, they decide, I'm all right, and then they end up with some terrible illness because they didn't go to the doctor. It's the same way. We're not forcing anyone to follow our guidelines. We're giving them access to the information that can help them have a healthier life. Is that correct?
Absolutely.
Mm-hmm.
All of our services are voluntary. And we really do take the serve and service that is really our goal. And so we really are there to just be able to provide here are the things that we can do. And if you feel like this is a fit for you and your family, we're going to figure out how to make it fit the best way that we can. And we're really here for, as in some instances, as long or as little as you need us.
Jen, I've interrupted you a bunch of times. Is there anything else you want to add about health equity that we haven't touched on yet?
While EveryStep's diversity, equity, and inclusion team is relatively new, and some of the, strategies and some of the specific groups and interventions are relatively new, this community is not new to health equity. And so, again, as we're learning more and we're unpacking more, we're making the necessary pivots to try and make sure that we continue to provide equitable services to folks in our community. But we could not do it without some of the core community partners that we have that have been doing this work and that have been working with communities that are impacted by these inequities for a long time. And so while we're really proud of the work that we're doing, we couldn't do it without community partners and without their guidance and their support.
It really takes a whole community to address all these issues. And so glad to be part of that community with EveryStep. Jen, thank you again for being on the show. You're always just a great guest with lots of information. You bet. Jen Groves is the Vice President of Community Health Services at EveryStep. If you have any questions about what we talked about today, or you are in need of services, or you know somebody else who could use our services, or you want to know what's available, easy to do. Just go to our website, www.everystep.org/care, everystep.org/CARE, and be easy to fill out a quick form. Somebody will get in touch with you, and we'll get you on your way to what you need. Hopefully we can provide it. That's With You at EveryStep, and I'm Polly Carver-Kimm.